Women and men experience stroke differently. Their risks are different, and so are their symptoms. How is stroke different between men and women? Hello, and welcome to House Calls. I'm Dr. Eduardo Sanchez, Chief Medical Officer for Prevention at the American Heart Association. Today we're talking about stroke and gender with Dr. Mitchell Elkind, the American Heart Association's Chief Clinical Science Officer. But first, this news. What's good for the heart is good for the brain. The latest indication of this is a new study in the Journal of the American Heart Association, which puts numbers to the relationship. It uses the Framingham Calculator for Cardiovascular Disease Risk to examine the connection of heart health to brain function. Cognitive function, that is how well your brain works, was measured using 3 tests: Alzheimer's disease word list memory task, digital symbol substitution test, and animal fluency test. Heart disease is the #1 killer of people in the United States. Stroke is number 5. Understanding the heart-brain connection is so important. Participants in this study with medium and high Framingham risk scores had lower cognitive scores than those with low cardiovascular risk scores. As Framingham scores increased, overall cognitive test scores dropped. The correlation suggests, as other research has, that strategies to reduce cardiovascular risk factors could also help prevent cognitive decline. This is important because dementia in some form affects 5.8 million adults in the United States. Proper treatment and positive behaviors, such as eating healthy and engaging in regular physical activity, can help with issues of high blood pressure, diabetes, or obesity, which can affect the heart and also the brain. Stroke affects men and women differently. In the United States, the lifetime risk of stroke is higher for women than for men. Stroke kills more women than men. In fact, it's the #3 cause of death among women. Stroke is more likely to be the first cardiovascular disease to appear in women, whereas for men, coronary heart disease is more common. Women have unique risk factors for stroke, such as pregnancy and menopause, and some of the symptoms that women have are different and may be mistaken for something else. There are age and social differences as well. Younger women are more likely to suffer ischemic stroke or transient ischemic attack, or TIA, a kind of pre-stroke, than men or older women. Women tend to be older than men when they have a stroke by about 4 to 6 years. And women are more likely to be widowed, unmarried, or living alone at the time of their stroke. The AHA's Dr. Mitch Elkind is a neurologist who has researched stroke prevention and treatment extensively. Dr. Elkind, tell us about the unique risk factors that women face.
Well, many of the risk factors that are specific to women have to do with hormones. So certainly pregnancy, the time around delivery, the immediate period after delivery, which we call the postpartum period, and then hormonal treatments like oral contraceptives or hormonal contraception of any kind, as well as postmenopausal hormone therapy. These are all risk factors that women have that men don't for stroke, and so it's important to be aware of those. The other important risk factor is migraine. Women more commonly have migraine than men because it's partly hormonally related, but migraine can serve as a risk factor for stroke as well. So these are some differences between men and women.
What is the most crucial thing every woman should know about stroke?
I think it's important for women to know that certain hormonal factors like pregnancy, the immediate postpartum period, oral contraceptives, and even postmenopausal hormone therapy can increase the risk of stroke.
What are some non-physiological factors that contribute to discrepancies in morbidity and mortality, and why?
Well, I think historically, people have tended to think of atherosclerotic disease or vascular disease as being a problem for men. But the fact is that women live longer than men, and so they live to the ages at which stroke becomes a bigger problem because the risk of stroke increases dramatically with age. So there's the need for more awareness among women of what stroke warning signs and risk factors are and what to do if they should experience those, which is to seek attention immediately. There's also the fact that women are frequently living alone at the time when they have their stroke, so there may not be somebody there to recognize that it's happening. Women play a caregiving role more commonly. They're under certain stresses, and so they may be looking after other people and not taking as good care of themselves as a result. And so it's important to educate people about the need to watch blood pressure, watch cholesterol and blood sugar levels, see a doctor regularly to get the preventive care that's needed.
In terms of stroke prevention, are there strategies that you would recommend, particularly for women?
Well, certainly women should address the major risk factors for stroke that are true for both men and women. I think that would be number one. Blood pressure is the most important risk factor for stroke. So knowing your blood pressure and getting it managed appropriately as needed would be the first thing. And then, of course, watching one's cholesterol, blood sugar, weight, getting enough exercise, not smoking, getting enough sleep each night. Those would be important factors as well. And then specific for women, it would be awareness of these hormonally related factors, the increased risk associated with hormonal contraception or hormonal therapy after menopause. Those would be things to discuss with one's doctor. And if one is having symptoms of chest pain or irregular heart rhythm, that's a really important risk factor for stroke, especially in women as they age, since about 10 to 20% of people as they get older can experience heart rhythm disorders like atrial fibrillation. So want to get that checked out and treated appropriately because we can prevent strokes in people with heart disease. And so real important to know about that.
So can you talk a little bit about the role that stress management or stress relief might play in helping women avoid stroke?
Sure. So stress plays an important role as a risk factor and really a trigger for stroke as well. And so stress reduction techniques like yoga or meditation, getting enough exercise, and getting support at home with management of the family too can be very important to reducing the risk of stroke and other cardiovascular diseases that can result from stress as well. So you have to take care of yourself before you can take care of other people, which of course is what a lot of women are doing.
Dr. Elkind, is there anything you'd like to add that maybe we missed or should re-emphasize?
Well, it's important for women to know about the warning signs of a stroke. At the American Heart Association, we like to focus on FAST, F-A-S-T, an easy way to remember the symptoms of stroke. F for face weakness, A for arm weakness, and S for speech difficulty, either speaking or understanding speech. Then it's T, time to call 911.
And that actually applies to oneself and to someone that one might be with. So FAST is a good thing to remember. If you see those things, act quickly, call 911. Dr. Elkind, thank you so much for joining us today. It's been a really, really great discussion.
Thank you so much, Dr. Sanchez, for having me.
If you have questions about health conditions and how they affect women and men, I would love to hear from you. Comment below, hit subscribe, join me here next time for Answers You Can Trust.